Yeah, hey guys, it's Dr. Emer, West Hollywood, and I have a patient here, darker skin type, that has a history of acne scars that we've been working on. She had pretty significant scarring. It's improved a lot doing a combination of microneedling, radiofrequency, peels, and Fraxel. We're kind of in between right now where I really feel she only needs a few more treatments to really get a significant improvement, and it's going to be with a combination of things. Right now we're going to do Fractora, which is our deep microneedling RF. There's others that are on the market, Infini, Vivace, Intensive, Profound, this. I find that this is the best for both skin tightening and for scarring. And for her, we're gonna do a more significant, setting. So we're gonna do the best we can. She's been numbing for a while. I'm gonna do a little pinch, just pulse and see how she's doing. How are you feeling?
It's fine.
You're okay.
Yeah.
She's really, really good. She's a really good sport. And what we do to make this work is we go real. We want to push really hard into the skin. That's why I feel bad. We numb, we pre-ice. You can even do nerve blocks if you really need it, but I just try and limit that if possible. And we just do some overlapping passes of the needles. And we just keep the skin really flat and tight. The energy is pretty high. We want to see a little bit of pinpoint bleeding. You want to squeeze the skin so it's 90 degrees. You're almost there. She's doing great. Sometimes you get some muscle twitches like that you just saw. It's normal. I mean, she's got really active muscle. You're doing great. Just need a little gauze. Lada, you can grab for me. Yeah, just gauze. We want to see that pinpoint bleeding, and I'll show you guys in a second what that means for the outcome. We're just doing cheek treatment. The great thing about this treatment is that any skin type can do this and has minimal downtime. Now, when we go a little bit stronger like we did today, you might have a little bit more downtime, but doing skincare and LED afterwards will make a much bigger improvement in terms of healing.
How many Fractora treatments has she had?
We did, I think, we've done at least 5 or 6 of the microneedling radiofrequencies, and we did 1 Fraxel, and now we're starting the Fractoras, which are a little stronger. So she's been doing treatments over the course of a year. And it takes time, you know, when you're darker skin type. We also did we do Cosmelon once or twice?
Once.
Once. And I think that would be good for her to do even a few of those. Doing great. Sorry, I know there's a lot of sort of twitching. And you know, the problem is with scars, it's a building process. And with darker skin type, we can't do really aggressive lasers like CO2. Even TCA cross on her causes hyperpigmentation. So we're gonna do a few more of those after we do another Fraxel. But she's done a lot of response. She's responded very, very well. And over time, she'll get a significant improvement. Hold still, here we go. We're doing double pulses because I want her to get more out of it. Most people do singles. There'll be a little bit more downtime, but she'll get a lot more improvement. Okay, last pass. Perfect. So now I'm going to show you guys back. Where's the other ice pack? Perfect. Put that right there. I'm going to show you the other side. Take a look. You see that all those little dots in there? You want to make sure that swelling and those dots are even. So if we come over here, you have to do another pulse, okay? Give me 1 sec. Your eyes closed. Good. Just to make sure we've really accomplished the degree of heating that we want in all of the areas. So that's perfect. It's homogeneous swelling throughout. Good. I'm gonna bring that back. I'm gonna switch to the other side. Hold on. Just gonna take a look. Now the swelling's come in and it looks very, very even to me. I'm just gonna do an extra pulse over this deeper scar. And then now we're gonna do her nose, okay? So stay steady for just 1 sec. So for pores of the nose, And for any ice pick scars on the nose, turn a little bit. There you go.
What kind of proper skincare would you need to do after this treatment?
Great question. So in general, we do exfoliating cleansers. We like Sente Derma Repair, vitamin C and B, and growth factors, things that have stem cells in them. And we have a whole regimen for her, especially being one more over here. Sorry, honey. A little bit darker of a skin type. Good. Now ice. Now she's all done. Darker of a skin type, even starting kojic acid and hydroquinone a little bit higher. And she's going to mask right now with vitamin B and C, cool her down with some ice packs, and then she's going to go home using exfoliating cleansers, Sente Derma Repair, vitamin C and B, and growth factors. And within a couple days, she's going to get right back onto retinol, hydroquinone, and Cosmelan 2, which is what we use for lightening of the skin and prevention of hyperpigmentation. She did great. We'll see her in a few weeks for the Fraxel.